Could PANDAS be causing my child's OCD symptoms? Imagine your child suddenly acting very different from usual, with intense worries or strange behaviors that seem to come out of nowhere. If this sounds familiar, you might be wondering what's going on. Sometimes, sudden changes like these are linked to specific medical conditions rather than just typical anxiety or stress. One possibility that parents hear about is PANDAS or PANS. These are conditions that can cause rapid onset of obsessive-compulsive behaviors in children. PANDAS stands for Pediatric Autoimmune Neuropsychiatric Disorders associated with streptococcal infections. PANS means Pediatric Acute Onset Neuropsychiatric Syndrome. Both involve the immune system reacting in a way that affects the brain, leading to sudden OCD symptoms. Usually, these symptoms appear very quickly, sometimes overnight, which is different from how OCD usually develops gradually over time. In PANDAS, the trigger is often a strep throat infection. When the body fights the bacteria, the immune system might mistakenly attack parts of the brain, especially areas involved in controlling behaviors and emotions. PANS can be triggered by other infections or even stress, not just strep. This means any illness or stressor can sometimes set off these symptoms. Common signs that your child's OCD might be caused by PANDAS or PANS include sudden, severe obsessions or compulsions that are hard to ignore. You might notice new fears or rituals that your child didn't have before. For example, they may wash their hands repeatedly or check things excessively. Mood swings, irritability, or outbursts are also common. You might see tics like blinking or throat clearing. Sometimes, children have trouble with fine motor skills, like handwriting, or develop new eating fears, such as refusing to eat or being scared of choking. Sleep problems, bedwetting, or frequent urination can also be signs. If your child's behavior changes suddenly after an illness, it's important to talk to a doctor. They can evaluate whether PANDAS or PANS might be involved. Early diagnosis can help you get the right treatment and support. Treatment often involves addressing the infection with antibiotics or other medications, along with therapy to manage OCD symptoms. Emotional regulation tools, routines, and open communication can help your child feel more in control and reduce anxiety. Remember, these symptoms are not your child's fault. They are caused by a medical condition that affects the brain. Getting professional help can make a big difference in helping your child recover and regain their emotional balance. If you notice these sudden changes, especially after an illness, reaching out to your child's healthcare provider is a good step. Understanding what's happening can help you find the best way to support your child's mental health and well-being.